Hey, in this video, you could take a quiz and see how you do with some trivia about abnormal behavior, psychological disorders, and this will help you review for homework assignments and quizzes. It may be a good idea to wait until you've reviewed the chapter a little bit, maybe not. Turning in your work for this assignment doesn't matter how many answers you get right, but be honest. Try to take it along with me. I'll read you some questions. There'll be multiple choice. You can answer on your own, score yourself, and I'll give you the answers right away so you can learn from that. And then you'll turn in something about this. So let's get started. Here's question number 1. You are talking to yourself in public and acting strange in other ways, suggesting that you might have A, amnesia, B, schizophrenia, C, avoidant personality disorder. Obviously, today's your chance to do some diagnosing. So is that amnesia, schizophrenia, or avoidant personality disorder? This is a sign of B, schizophrenia. Strange, odd behavior, odd, bizarre delusions, thinking, thoughts that are far-fetched, hearing voices, seeing things that aren't there. Those are some examples. Emotional and social behavior problems. Okay, 2. You have an unusual fear of school tests, but no other odd fears, so you have specific phobia, agoraphobia, or social anxiety disorder. Which is that? Specific phobia, agoraphobia, or social anxiety disorder? That would be A, specific phobia. Specific phobia is something narrow and not so generalized. Something like a fear of snakes or heights or water or dogs. That's specific phobias, whereas agoraphobia is more spread out to multiple situations and fears, often leaving the home, but it incorporates things like driving, going over narrow bridges, things like that. Okay. 3. Which is the current terminology for this disorder? Multiple personality disorder, personality identity disorder, or dissociative identity disorder? So having multiple personalities that don't know about each other, not just change in mood, but a total change in personality and mannerisms and dress and style of speaking. Is this A, B, or C? This would be C, dissociative identity disorder. It used to be called multiple personality disorder, but we have changed it. Dissociation is a major characteristic of these disorders. 4. If all Mount Hood students used methamphetamine 4 times a day, and you were not using it at all, would you be considered abnormal by the maladaptive behavior definition? Yes or no? So if all Mount Hood students use methamphetamine 4 times a day, and don't give me your, well, so what reaction, or I'm making this up, by the way. Okay, so would you be considered abnormal? The answer is no. Maladaptive behavior requires you to have problems with your daily functioning as a result of certain behaviors and these symptoms. And while this may be considered a problem by some, you would be statistically deviant, abnormal compared to these students in this hypothetical situation, it would not be considered abnormal by that definition, the maladaptive behavior. 5. You think it is a sin to even think about sex for 1 minute, so you take 10 showers a day to make yourself feel clean and rid you of this severe anxiety or reduce it. The showers are A, an obsession, B, a compulsion, or C, both. So taking the showers to make yourself feel clean, because you do think about sex now and then, and you've got to get rid of that. That would be considered B, a compulsion. Compulsions are behaviors, obsessions are thoughts. Sometimes people with obsessive compulsive anxiety have both of these. Sometimes they do more one than the other. 6. Which personality disorder includes chronic maladaptive traits such as lacking empathy, being egocentric, and disregarding rules? Is it antisocial, borderline, or passive-aggressive personality disorder? So again, A, antisocial, B, borderline, C, passive-aggressive. That would be A, antisocial. Sometimes in our culture we use the word antisocial to mean what psychologists would call asocial. That means you are introverted, you're not interested in socializing and interacting with others. But antisocial in the mental health field and diagnosis means that you have disregard for rules, you have problems controlling yourself sometimes, you're the focus, very self-centered, not much of a morality, lacking empathy for other people. And sometimes these people can be fairly functional and hide it quite well. But if you get to know them, you have a long-term close relationship with them, it will probably come out. Hope you're doing well so far. A few more questions. 7. The D, that's the 4th letter of the alphabet. The D in DSM stands for dictionary, diagnosis, or disorders. So DSM. The D in DSM, what's the DSM? I'm going to explain it in a second. So DSM, does it stand for dictionary, diagnostic, or disorders? It is B, diagnostic. The DSM is the Diagnostic and Statistical Manual. That's what the DSM stands for, of mental disorders. It's been used for multiple decades to categorize and label and identify the symptoms in different mental health disorders. 8. Which version of the current DSM are we using now? Is it the 5th, 6th, or 7th? 5, 6, or 7? So it's been revised a number of times over the years. What's the answer? 8, 5. 5th version right now. When I was in training in graduate school, we were on the 2nd version. So it's been modified and improved over the years. 9. Many of the current antidepressants, such as Prozac, do what to nervous system serotonin levels? They increase, decrease, or neither. So many of the current antidepressants, like Prozac, affect serotonin levels. That's a neurotransmitter in the brain, in the nervous system. Does it increase, decrease, or neither? What's the answer? It's A, increase. More serotonin means better mood. So that's what we're trying to do with these medications. 10. Amaxophobia, that's spelled A-M-A-X-O, phobia. Amaxophobia is an odd fear of A, floods, B, riding in a car, or C, walking. Amaxophobia, what's your choice? Floods, riding in a car, or walking? The answer is B, riding in a car. Okay, 11. 2 more questions we've got. See how you do. One biological theory about manic episodes is that they are associated with an increase in A, norepinephrine, B, potassium, or C, gabapentin. So one of the biological theories about manic episodes is that they are associated with an increase in A, norepinephrine, B, potassium, or C, gabapentin. Norepinephrine is the answer. That's A. And let's have the final question for the day. Number 12. During the Mount Hood Community College quiz, you can't stop thinking about religion and worrying about whether you'll go to heaven or hell, which is distracting from you in taking the test. This is an example of A, a manic episode, B, depression, or C, obsession. So is this an example of manic episode, depression, or obsession? Answer is C. Constant dwelling on thoughts that are interfering or causing significant distress is a sign of obsessiveness. Obsessive thinking, you might have anxiety, an anxiety disorder, or an OCD, obsessive compulsive disorder, but the symptom itself would be an obsession. So hope you did well. We'll see you next time.